Despite millions of them being born every day, newborn babies are the most exciting thing in the world. But let's face it, babies are scary and strange, and nobody gives us a manual. I'm Dr. Eli Fryman, a board-certified pediatric emergency medicine specialist and father of 3 who sees over 3,000 patients a year clinically in the emergency room. In this video, I'm going to discuss 4 strange and potentially scary things that a newborn baby can do that are actually totally normal. If you're new to this channel and can take a second to like and subscribe, you know I'd appreciate it. The first strange and potentially scary thing that newborn babies can do is something called periodic breathing. Breathing issues are one of the most common reasons new parents bring their baby into the emergency room to be evaluated. While there are many things that can go wrong with breathing in the newborn period, this one in particular is totally normal. Periodic breathing is a type of breathing pattern in young babies where first they'll breathe very quickly for a couple seconds, and then their breathing will really slow down to a point where it may look like they're not breathing at all. You can imagine this really freaks parents out, especially if they've never seen it before. Periodic breathing occurs because these young infants are still maturing and growing neurologically and can take weeks or even a month or 2 to really even out into a steady breathing pattern. While these couple seconds of slow breathing and pauses in breathing can really freak parents out, the good news is periodic breathing is very common and totally normal. As long as these episodes aren't associated with fever, color change, low oxygen, or other concerning signs, I'll typically just watch these babies for a short time in the emergency room and then discharge them home. The second strange thing that young babies can do that totally freaks parents out is spit up blood. And I know what you're thinking. Really? Spitting up blood? That's ever okay? I see a couple babies in the emergency room every month that are brought in by their parents because these parents noticed blood in the baby's spit up. And while yes, there can be rare or potentially dangerous causes of a baby spitting up blood or vomiting blood, and if you ever have any concerns, you should talk with your pediatrician about it, most of the time it ends up being something really simple and harmless. The most common reason I see, believe it or not, is a baby who's nursing from a mother with dry or cracked skin. Moms may not even notice, but that skin can bleed even just a little bit, and the baby can swallow that blood during breastfeeding. That small amount of blood is totally harmless for a baby to swallow, but gosh, it can look really scary when they spit it back up an hour later. I've also seen babies spit up a small amount of blood because maybe they were a little congested and had just a smidge of a nosebleed. While you might think that with a nosebleed, all of that blood comes out of the nose, actually some of it probably goes backwards into the throat and then gets swallowed. Since babies spit up so much, that blood that they swallowed from that minor nosebleed might come right back up an hour later and alarm these new parents. And believe it or not, I've actually seen babies brought into the emergency room where they weren't even spitting up blood at all. They were actually just spitting up red food or food with red food coloring and dyes that they'd been given an hour earlier. I certainly do love telling parents that what they thought was blood in their baby's spit up actually isn't, but boy, do those parents feel a little bit embarrassed sometimes. The third strange thing that babies do that can be totally normal is break out in these crazy rashes. About 1 in 5 babies, or 20%, can break out in this really striking rash in the first 3 days of life called erythema toxicum. The baby's skin actually breaks out in these red bumps and patches that over time can actually start to look like pimples. Thankfully, this rash isn't actually harmful and tends to resolve on its own within 1 to 2 weeks and really doesn't require any intervention. Another really common rash is called seborrheic dermatitis, or as you might recognize the name, cradle cap. Cradle cap typically starts a little bit later when babies are a couple weeks old, but can last all the way through a baby's first year of life. It's estimated as many as 1 in 10 infants end up developing cradle cap. And while it's not exactly clear what causes cradle cap, we know that it can cause these thick, greasy yellow patches on a baby's head and face, sometimes even with a little bit of redness surrounding it. The good news is, similar to erythema toxicum, seborrheic dermatitis or cradle cap also typically resolves on its own without the parents needing to do very much. If the rash is really bothersome or persistent though, parents can apply a white petroleum ointment like Vaseline and maybe brush it a little bit with a soft toothbrush or other soft baby brush to get some of those thick scales off. The fourth strange thing that babies often do that can be totally normal is actually not poop for days at a time. When you have a newborn, parents get very used to babies pooping multiple times a day, often with every diaper change. As these babies get a little bit older, a couple weeks, closer to a month, maybe 2 months, parents often notice that the amount of times that a baby's pooping a day drops drastically. While it might be nice to change a couple fewer dirty diapers, it starts to worry parents when a baby goes from pooping 4, 6, 8 times a day to maybe not pooping for multiple days at a time. As a baby gets a little bit older, their intestine just gets a little more efficient at utilizing the milk that they're drinking, even more so if the baby's breastfed. What ultimately happens though is parents bring their baby into the emergency room because they haven't pooped in 1 or 2 or 3 days and are really concerned that their baby is dangerously constipated. Many pediatric GI specialists have told me that as long as it doesn't go longer than 1 to 2 weeks and the baby still looks well, they're eating, they're still peeing, they're growing, they actually typically don't recommend much intervention. And that makes my job in the emergency room easy because I get to see a cute baby and then send them home from the emergency room without any further testing. It is really important though that with all of these conditions, the baby is seen by their pediatrician sometime later in the week just to make sure they're still happy and eating and growing. So yes, babies are very cute and they can be very exciting, but they can also be really strange and scary sometimes. If you liked this video, please hit like and subscribe. And I have another recent video on what to look out for if your kid has a scary head injury. Thanks for watching, and I'll see you all back here real soon.